the speaker of this transmission. So with the coronavirus observatory, we can monitor day after day all the situation in Lombardy and more or less also in Italy. I begin with one thought. In a globalized world, it was not difficult to predict that coronavirus would also arrive in Italy and in Lombardy, the region most inserted in international routes. There was a window of opportunity. That is the term used by WHO between the discovery of the virus in China and its appearance in the West. The window of opportunity was a formidable opportunity to better organize the response by avoiding finding ourselves unprepared. Instead, nobody happened in Lombardy and nobody happened in Italy. The problem is this. So we have a health system focused only on care and profit, which has transformed health into a commodity, which ignores prevention because it doesn't produce profits for the private lobbies of the sector, and which does not involve the population in the protection of their individual and collective health. So this is Achilles' heel in front of a new infectious disease of easy transmission. These deficiencies are not random and not limited only coronavirus affair. Today in Lombardy, there is the possibility to being cured with the best therapy available in the world, of being operated by teams with top-level professionalism. Although the portfolio often makes the difference, but the prevention services are reduced a minimum. First aid, almost all are in highly critical condition. General practitioners are in a short supply. Territorial clinics are reduced in a number month after month. These choices are before the private health structure are inside the public service. There is an agreement. Until now, the 40% of the public regional money for the health, the 30% is for private sector. And private sector is not interested on first aid, is not interested on emergency department, is not interested on infectious disease department, because private sector is looking for more profitable sector of the medicine. This is the first problem. But the second our problem was that the political leadership of our region organized the public health system in the same way of the private health system. So they destroyed, they left alone completely all the prevention department. For example, we are in the second phase. It would be very important to have a public service to control the situation in the workplace, because the workplace reopen again completely. But our health public service about workplace don't exist, or they have only few people, so they are not able to control anything. The leadership of a region didn't organize anything also about the instrument of protection. For example, our medical doctor work for more than 2 weeks without any protection. And the result was that now we have hundreds and hundreds of medical doctors in public services that they are ill, they have coronavirus, COVID-19, and this is not normal. The leadership of a region didn't organize anything about the guideline of WHO about the protection, about the prevention. And another problem is that in Lombardy practically don't exist any epidemiological study. And the leadership of the region was not able to use the test to look for virus. So they use this test without any specific scientific strategy. They use only for symptomatic people. They don't use this test to look for the contact, the people who were near the people with positive situation. And so the virus didn't arrive in contact with any obstacle in his action. The result is that we have had thousands and thousands of people in the hospital. But when these people arrive in the hospital, because the first line was not working well for the choice of a political level, so a lot of people arrive in the hospital. But we had no enough place in the emergency department, and our doctor have had to decide which person they can cure, which person they can try to save, and which other person was abandoned completely by the doctor, because there was not enough health machine to cure this person. Another dramatic situation was that the medical doctor on the territory were not able to visit the people because they haven't a mask. So they visit the people only by phone. And it's clear that it is not the same things. So now we have the half of the number of the people who died in Italy. The people died in Italy until now is about 32,000 people. 16,000 people died in Lombardy. Lombardy has a population about 10 million of persons. So the first reason is privatization. The second reason is the way to organize the public system in the same way of private sector. And the third idea that is very important for the future is that in Lombardy, the health system is practically only about the cure. I know that we are the first in Italy, and probably one of the first regions in Europe for the cure, for the surgeon intervention, for a special trial, but only for this. And now there is a center, a very, very scientific, very, very important scientific center in Milan for the study about genome. But in the same time, the people who are looking for a visit or for a little surgery intervention must wait month and month because this is not important for the profit. And the situation became absolutely dramatic, not only in Milan, but everywhere. I stop here. I think it's enough with my time.
Thank you, Vittorio. Yes, thank you for sharing this. It was very clear. So a combination of, structural weakening of the system, also deliberate choices of the political leadership in orienting the healthcare system towards cure and neglecting or eroding or dismantling the primary level services. I just want to add that despite Emilia Romagna, the region I'm from, is the opposite, it's a bit the opposite model. So it's claimed as the region has gone more to the public and strengthening the national health, the regional healthcare services. Nevertheless, some of the structural weaknesses that Vittorio pointed out, and namely the lack of people, I mean, concrete resources, people, bodies, brains in the public health departments, has been also a serious challenge, and even affecting the second phase. So we see that our system has lost the capacity to prevent and to be close to the people, to organize the very first line of protection. And I think this is widespread throughout the country. Okay, I will now ask to Manuel to comment on the same aspects. So what happened in Spain, and was it different? Was it similar to what Vittorio described in terms of a malfunctioning healthcare system in some areas, which was deliberately shaped in this way, and impact on the response that has been or hasn't been organized to address the epidemic? Manuel.
Yeah, thank you, Chiara. Well, the experience in Spain is very similar to the one described by Vittorio. I will start giving you some background of how the National Health Service evolved from the last 30 years in Spain. In 1986, the General Health Law was approved, establishing a new framework for healthcare. This law allowed, in others aspects, the implementation of the primary care model that we have today. The political pressure, though, left the door open for private companies to do business at the expense of the National Health Service. For example, Article 90 from this law allowed the referral of activity to private hospitals, provided that the public hospitals have previously optimized their resources. During the last 3 decades, cuts and closings have occurred in public hospitals, and while complex treatments were carried out in public hospitals, the easy and economically profitable treatments and tests were transferred to private ones under the so-called concerts. This has been the keynote in the entire state, regardless of who governs. All politicians have used it, demonstrating that connections between public managers and private healthcare. The result is that around 8,000 million euros are directed to private pockets through concerts every year. But there are great territorial variations. For example, in Catalonia, 25% of the health budget goes to the private sector, while at the state level, it is around 12%. It is very interesting that just 5 years after the approval of the General Health Law, and having barely allowed to develop the contents of primary care, the Socialist Party, the known PSOE, launched the so-called April Report with the supposed aim to modernize health. The recommendations of this report were clear. The health system must function as a private company, and as such, the criteria of efficiency and savings had to be applied. These recommendations, drawn up by experts, some of whom were related to the pharmaceutical industry, were soon implemented. Still, the General Health Law constrained the private sector, and therefore it was necessary to modify it. For this, a new law prepared in 1997, which allowed any health or social health center in Spain to be managed and operated by companies with profit motivation. I have to say, though, that the penetration of the private sector was very different in the various Spanish autonomic regions. Catalonia, for instance, the region from where I come from, had already developed its own model, mostly in private hands. From this point, everything was much easier for the private sector, with the right party, PP, in government, the nationalists opening ground, and the PSOE allowing to do so. A process of deterioration was accelerated with even more closures of public centers, which were replaced by the so-called public-private collaboration. Of course, the collaboration consisted in that the public money was the benefit of the private sector. The added problem was that some of these centers were awarded for the case to venture capitals, construction companies, or banks. This kind of activity has left a trail of extra costs and corruptions and a reduction in the capacity of public health centers. And as a result, we have seen a reduction of the budget directed to the centers with pure public management, a planned decline in primary care, a dramatic increase in surgical and diagnostic waiting lists to unknown limits, an exponential growth of private insurance, and a continuous change of hands of shares of the privatized hospitals. It was clear that any increase in the needs of care of the population was going to cause the collapse and the lack of response from the health system, and it has been evidenced by the COVID crisis. Now, regarding the COVID pandemic, which is very similar to Italy, the number of infected people, only those diagnosed by PCR, is of more than 231,000 since the beginning of the pandemic, with almost 28,000 fatalities. We have the highest figures of fatalities in the world per million population. In Spain, Spain leads the world ranking in this respect, and here I'm going to give you some figures. In Spain, there are 594 fatalities per million population, whereas in Portugal, which is a neighbor country, identical people, similar lifestyle, the mortality was 102 per 1 million population, which means 6 times more in Spain than in Portugal. Germany, for instance, got even less, 81 fatalities per million people. And in contrast, Cuba, a socialist country, and possibly economically not as high as other countries in Europe, but very well developed primary care in this country. They got only 6 fatalities per million inhabitants, the best in the world. Well, the healthcare professionals have also been affected very badly, as Victoria was already mentioning. There are almost 44,000 healthcare professionals, that is 20% of the workforce, that have been infected by the virus. So in summary, the public health system in Spain is down, while private healthcare is blooming. And arriving at this point, the question is, can we keep the healthcare system out of business and profit and rebuild a universal healthcare system? Certainly, we don't expect anything from politicians, whether from the right or from the left. It's my belief that if we want to defend the public healthcare system and reverse its privatization, the citizens should organize themselves through social movements of whatever way. It is very important that the laws that have turned the healthcare into a bazaar and repeal and the public health system is shielded, so that no €1 of our taxes can ever go to private pockets. My other question is, can we organize ourselves at the European level and be able to produce a law to back up the public health system, a law that have to be presented and defended in Brussels? Dear friends, there are no other ways. And I finish here.
Thank you very much, Manuel. Very clear from your presentation. I would like to highlight how you pointed out that it was not really a matter of political parties, and I think we have the same in many countries. So it's not like the so-called left has acted very differently in terms of pushing for a more or less explicit privatization of healthcare. And also how you highlighted how the the links between public management and private management and private profit are very close, are very tight. And also pointing that what we call private is actually subsidized, as Vittorio also pointed out, heavily subsidized by public money. So it is our money that is going to boost that profit instead of our health. Also, I think you highlighted very well primary healthcare again as the front line that's been really weakened, and that we were seeing the bad consequences of this. And finally, also calling for movements and resistance, and this is very important for us, as we are here also to strengthen this kind of connections. And luckily, we do have some networks that need to be even more strengthened. We're now focusing a bit more on what happened in retirement homes, and it is really a tragedy that speaks not just about the virus, that speaks about, I think, a much deeper problem in our society that is now violently exposed by what has happened. So in all our countries, we have seen a high percentage of deaths happening in retirement homes for the elderly. So I will get back now to Manuel to comment on how he sees what has happened in Spain in this particular area of health, what should be health protection, that has become actually an area of high contagion and death.
Okay, I will be very brief. It's a complete disaster in here. In Spain, there are approximately 5,400 Spanish nursing homes. Of these, 3,800 are private and 5,500 are public. This makes for a total of around 373,000 beds, with more than, let me see the figures, 270,000 private beds. That is almost 2/3 of the nursing homes are beds in private hands. So imagine what is the result. These nursing homes are run without any type of control. And the consequences of all this is very high death toll recorded in nursing homes during the COVID pandemic. The latest figures are that more than 19,000 elderly people have been killed by COVID in Spain, which represents 71% of the total officially notified deaths. Interestingly, most of the deaths have occurred in 4 autonomic communities: Catalonia, Madrid, Castilla y León, and Castilla-La Mancha. The 71% mortality that I quote in Spain contrasts with 50% in Italy, your country, 35% in South Korea, or 40% in China. It is really disturbing that the army had found deceased elderly people living with other residents in these centers. And because of this, the State Attorney General Office maintained more than 200 civil and 150 criminal proceedings in relation with the management of the COVID crisis in residencies. As with the healthcare system, we need to revert residencies to the public sector, implementing the necessary changes in their management and healthcare. This is a terrible, terrible problem that we need to solve with urgency. So I finish here, I'm being quite brief.
Thank you, Manuel. I think actually the numbers speak very well and very harshly as well. Vittorio, now on to you on a not better situation actually in our country. Vittorio, il microfono.
Okay. Okay. You listen me?
Sì.
Perfect. All right. So before I would like to give you some numbers, some data, so you can confront with the data of Manuel. For example, in Lombardy, we have had 160 dead every 100,000 people. That means 1,600 dead people every 1 million is in Lombardy. Another number is about the beds, the hospital beds, the place hospital beds. In 1981, immediately after our health reform for a universal system, we had 530,000 beds in the hospital. In 2017, so 3 years ago, we had only 230,000, so less than half beds in hospital. And this was one of the cause of a disaster. Another news that I think that could be important is that now in Lombardy, practically you can go for pharyngeal swab only in private laboratory. The health public system organized pharyngeal swab only for the people in a symptomatological situation in hospital. If you are not symptomatic, if you are a contact of the people with COVID, if you have had COVID before, and now you must go to work, you must pay by yourself the pharyngeal swab. And also the research of the antibodies, you must pay by yourself. So it's a big profit for all the private laboratory. We have a lot of retired home with thousands and thousands of people inside. You must think that the mid-age of the people died in Italy is about 79, 80 years old. So these people is in a very, very dangerous situation. The 8th of March, the government of Lombardy take a terrible decision. Ask to retired home to host COVID people with infections that who were going out of the hospital, because in the hospital there were not enough places. So after the more dramatic situation, the COVID people can go out of the hospital, but out of the emergency department, but not inside the other hospital, but inside retired home. The retired home were full of a lot of older people. So was a tragedy because a lot of these people became infected and they died inside this home. And there was no relationship between this home and the people outside, between the people inside and the family people outside. They can speak only sometime with telephone, and the people hadn't any news about the family people inside this home. Not only the health people who was inside this retired home had no enough mask, no enough protection instrument. So a lot of these health people became ill, and there was a lot of demands, and now the judge are working to look for responsibility. And the reason was also because in the years before, the region didn't want to build a special hospital like intermediary situation, not for acute situation of ill. And so the region didn't know where to put these people that had to go outside the hospital. In Bergamo, that one of the town in Lombardy, there was for some weeks 10 tents, I don't know the name in English, the place with the tomb for the older people, with the camion, full of the body of the people died, and the family people cannot participate to the funeral of their family died. It was really a tragedy. But on the other side, the owner of the retired home are private, because there is an agreement between the owner and the public system, but the owner are private. And so they were very happy to receive people with COVID, because the public instructor, because the region pay a lot money for every night of a COVID person inside the home. Okay, I finish here. All right, is my time? Okay. Because I listen a word. Was finished the time?
I don't know, Vittorio. I also heard an interruption. So you can finish your sentence if you want.
Okay, so I said that this, I explained that this was really a tragedy, and we count a lot of thousand people died inside this structure. On other side, there was another important situation. The region tried to hide the number of the older people died. So when the medical doctor called to the public number to say, I have a person about 18, about 17 that is ill, we need to go to the hospital, the public system said, no, it's not a necessary hospital. So a lot of older people died in his home, and there was no diagnosis about COVID. Formally, they died for other reason. So we think that the number of the died people inside Lombardy for the COVID is probably twice than 16,000 people. You must think that now about 10 million of people, probably in Lombardy, we have among 500,000 people to 1 million in the middle COVID positive person. This is our situation now. Thank you.
Thank you very much, Vittorio. I am just a bit concerned with time, so I will not make my remarks now. I'll save it for later. And I would like now to give the word to Veronique. I already introduced her. She has both a Belgian and a European perspective. So, but first, I would like to ask her to give us her view about the situation in Belgium, how it relates again to what we heard in the other countries, how it is specific, and what is happening now.
Okay. So we started in Belgium with a problem. We didn't have a government. So we had to decide quite fast to have a new government, an emergency one, okay, to respond also to this epidemic. You have to know that in Belgium, there are no private hospitals as in Spain or in Italy. Also, you have sort of private structure who are non-profits. And the public hospitals are organized by the cities, and the private hospitals, they are usually organized by doctors, and the way to finance them is a little bit different. But all the money comes from public money, our money, as you said before. So when the COVID-19 struck, they have to decide it very fast how to react. They put all the hospitals on an emergency plan. All the hospitals had to empty the wards, cancel all the operations were not an emergency, and prepare themselves to receive all these new potential COVID patients. They were afraid to be overwhelmed like Italy, and they tried to prevent that. And I think they did they did succeed in preventing to be overwhelmed by all the patients, although that we were at certain moments on the verge of the limit of intensive care beds, and there was a lot of concern in the public because they decided to keep all the people who were in retirement homes. So the people who were there were close to the family. They did not receive any visits anymore. They wanted to prevent contamination to this fragile public, but they did not succeed in it because in certain retirement homes, and I think they were the private ones mainly, you had outbreaks of Covid-19. There was one home in Brussels who was struck with 13 people who died within days in the beginning of the epidemic. We discovered also that the nursing assistants who worked in these places didn't have protection. They didn't have masks, they didn't have gowns, they didn't have enough gloves. So without knowing, they were probably contaminating the residents who were not sick, who were not yet sick. So in Belgium, the retirement or nursing homes are still 40% of them are still in public hands, and the rest is in the hands of a smaller non-profit organization, and still a growing part is in hands of big corporations like Harmonia or Corian or other ones who try to get money out of these elderly people. And the market has been expanding since the need of these homes has been rising because the population gets older like everywhere here in Europe. And because the beds are limited in Belgium by the public authority, the pressure was strong on these places. So they didn't put the retirement home in this emergency plan. They didn't give anything. They didn't have the systems to detect people who were sick, who were at risk. So I think we lost a lot of time in these retirement homes. For the hospitals, when we were on the verge of having all the intensive care beds being filled, there was a plan between the hospitals to transfer the patients from one place to the other in case it would be too full in one place, like they did in France. But because Belgium is smaller, it's easier. All the healthcare staff in all the hospitals were moved from one place to the other. Within days, the people had to change the way they had to work. They had to move to other places, meet new colleagues. The same happened to doctors. For now, the situation is calming down in Belgium. We have less and less infections. The hospitals are slowly trying to get back to a more normal business, but it's still not possible because of the rules of protection and of distanciation. They cannot have all the patients in one. So the activity of all the hospitals has been slowing down by like 30–35%. But if the activity is slowing down, this will be a very big problem for the hospital because there is no money coming in, because they need this money that is generated through the activity of the doctors to generate money to make the to let run the hospital, and all this money is not coming in. So, for example, one of the hospitals, the public hospitals in Brussels, has been showing us the numbers, and like usually they generate 300 million in a year, and they know already that they have a gap of about 50 to 60 millions. Do we have time?
Sorry to
Yes.
To interrupt. Can I ask you the second question? Is there something again more important that you want to say? Okay, because we're a bit out of time. Maybe we can get back on the questions and answers. So thanks for sharing all this about Belgium. And since you're also part of the European network against the commercialization of healthcare, can you also, in a very few minutes, we know it's limited, but give us just an overview about the situation in Europe.
In Europe, okay, I will focus on the attitude of the European community, okay? Since years and years, the European community has been putting a strong pressure on all the European countries to lessen public expenditure. So they have obeyed to these injunctions and have been lessening the funds they are giving towards healthcare. But because of the pressure on healthcare, the budgets are not raising anymore. So my main reaction to what happened is also that the European community was not very reactive to what happened in the countries who really needed help, like Italy and Spain. There was a sort of lack of reaction. It should have been much faster. And the solidarity should have been expected. Maybe funds who should have been given much sooner into the epidemic have been slow to arrive. But for me, the future is more important, because I think that the EU has to be pushing the countries to more solidarity, but I don't know how they will do it. And they have been constructed a European Union on an economic basis, and what we lack is the social basis. They still use a sort of way with the European countries of, on one way, they give financial injunctions, and then on the other way, they give injunctions on the structures the countries has to follow, or the nursing staffing. They just gave to Belgium injunction. They said you have to raise the nursing staffing, but how can we do it if we don't have enough money to finance this staffing? So I think that the countries who best resisted to the epidemic were the ones who had still a strong publicly organized healthcare, and I think this is the way we have to follow to push the European agenda to help the countries to achieve this.
Thank you very much, Veronique, for in a very short time for giving us also a direction of where our struggles at the European level may try to aim at. So we now have our final speaker, Luca Scarpiello, to give us a trade union perspective on workers and health workers. what happened to them in this period, and you know, I mean, what are the key issues that also they are facing in this time and will be facing in the near future? Luca.
Thanks a lot. Thanks, Chiara. I think, well, good evening to everyone. Well, I think that one of the good things of being the last one is that you can avoid of repeating a number of elements and figures, and maybe I can try to articulate a number of elements also that are connected to this, but also in particular to the issue of privatization. I think that we all know, actually, one thing I wanted to say you in advance is that actually one of the things that make us proud, not only me, not only the comrade from the Belgian unions, but also many of our people connected, is that we in EPSU are representing not only one professional category in the hospitals, and not even nor the public or the private, but we try to represent all the workers that are in the establishments, that are in hospitals, that are in social services. And I think that this gives us also quite important and interesting glance of the situation from this point of view. The situation, it's clear, I will start with something banal, that actually the outbreak has highlighted a number of problems that there were already in the hospital. And I think that we cannot start, for instance, from one of the most clear examples that are actually protective material. We have been always saying that the situation of the healthcare workers was exacerbated, and by exacerbating and making worse the infection of the healthcare workers, we gave a substantial contribution not only to increasing the danger for themselves, but also increasing the outbreak, because the hospital became what we call the super springs, were the one that actually also gave, together with social service facilities and long-term facilities, a contribution. And this happened largely for two elements that we have seen clearly. On one side, the lack of protective material. And I think that there are two aspects that needs to be taken into consideration. The first one is that many times we say that Europe was not prepared to the outbreak, and this is true. But it is true also that we had already two pandemics in the past, the SARS and the MERS pandemic, and Europe already there took a commitment to stockpile protective material. But when this arrived, clearly there was no stockpiling. And I think one of the things that we are already asking, we will ask in future, why this couldn't happen. What's so sudden, this epidemic? Why we arrived to a moment at the beginning of March where member states were competing each other? And competing on healthcare is really one of the worst things you can do during a pandemic instead of cooperating. And we couldn't have any stockpiling. And therefore, also for the future, it is fundamental that Europe not only create a strategic stockpiling, but also in particular that clarifies procedures, how to be ready for the future, and also clarify why we didn't do for the past. One of the things that we believe is that one of the reasons why was that there were simply other priorities, because healthcare was also in the last budget, and we know in the MFF, already in the last proposals before the outbreak, healthcare funds for public healthcare were supposed to be cut by around, I think something like 100 millions of euros, which is nothing but gives you clearly a direction. A second problem is that also for the future, we have different kind of privatization. One of the worst is also that we don't have means at the moment to create and to have clear supply chains of protective material in Europe. We did not have anything, and we don't have yet. So we arrived to the moment where we will need, for instance, only for Italy, I've heard that we need something like 4 billion of masks every month to supply all the different needs. And instead, we don't have the possibility yet to produce them because the supply chain is completely privatized also for this element. Second element, safety provisions, which were extremely extremely not clear. For instance, the aspect of testing has not been clarified until April, and yet now one of the provisions from OMS, but also ECDC, was to test only those from the healthcare staff, which has been showing symptoms, disregarding completely also those that, for instance, were not showing symptoms, and also in general, also those that could not afford simply to take days off, because also at the beginning of this crisis, the classification of COVID within the hospital as occupational disease, and also something where people was encouraged instead they could not take days off to stay home, were not clear. We had a number of people that also exacerbated by the outsourcing, so the different players that in hospitals manage workforce, and that in many cases either you are present or you don't have enough salary because maybe you have a precarious contract, were forced to go to work. We know now that those things were at the bulk of the pandemic. And this is an element. Third element that I think it's also important for our discussion is actually the lack of staffing. We have now an entire generation of, we have had for the last 10 years actually, I give you always the example for Greece, we had a cut in the last 5 years due to the Troika of more than 13,000 doctors and 26,000 health workers only in one country. And those are Eurostat giving those. And this is clearly that we arrived to this outbreak without the workforce we needed to provide also the public healthcare, the primary healthcare needed. So we are coming also from years of disinvestment and also of cut to the workforce, substituted also in many cases by now young doctors, which, for instance, has been put many times with precarious contract in our hospitals. And one of the key demands that we are asking now is to provide also to those people security also for the future. Now, I think that one of the elements I agree with Vittorio is Artusa too. On one side, that we will have a lot of money coming in our systems, and we will have a lot of money arriving. How this money will be spent? Because already now you see private healthcare, big players like Orpea, Harmonia, Corian in social care that are already going, featuring the reality on what's happening in the hospital, saying that private healthcare was key for preventing the outbreak. But now actually the real battle starts, because we are to a kind of, we can choose between giving money also to the private sectors to continue working on the same models that feature the semesters and so on, or we can choose, for instance, other kind of investment in the basic primary healthcare, but not only, also in decentralizing healthcare. We don't have to put people all in big hospitals. We need also to invest into territorial medicines, reorganize services on the territory, and doing it on a public basis. We hope that we will fight, and we know that, and it's good that we organize those moments, because I think that those fights will need to be carried together also for the future. Thanks.
Thank you very much, Luca, also for sticking to the time and for very effectively highlighting the areas of where the problems were, and also the areas where we should make stronger choices and pressures for the coming period. We're now with a bit of delay, but I'm happy to open the debate. Prior to this, I would like to give word to something that was shared by members of the Bulgarian trade union, nurses trade union, which have in these days asked for international solidarity for their struggle. They're sharing that even though the COVID-19 epidemic wasn't so bad in Bulgaria, but the conditions of healthcare and conditions of health workers is particularly problematic. That the system in Bulgaria has been commercialized, so all the hospitals are commercial societies, and they have to generate profit. And the wages of the staff is based on the number of patients treated, and so it's based on the economic activity that the hospital is able to generate. This condition, of course, places the health of the patients and of the staff in the second place compared to the economic aspect. And also in Bulgaria, as we have seen, it's actually public money that subsidizes this private and commercial system. So this management has really increased the inequalities within the health sector, with some people who became very rich out of this, so managers and senior doctors, and other workers that are paid even below the average wage. So the nurses particularly are leading now this struggle, and they have been now for more than a year. They have been mobilizing, and they share their motto, which is health is not a commodity. It's a matter of national safety and common law. Saving lives and caring for people is our goal and not profits. So this is actually a call. You will see, we will then circulate also the link for supporting and sharing in solidarity this struggle. Solidarity is our purpose. That's how they end their statement. Okay, I think I will just. I would like to give space to the questions, so I'll not make my remarks here. So there's a question that was posed to Manuel, which I think is quite interesting, probably for many, which is about the news that we heard that the government in Spain was sort of taking action to nationalize private hospitals. Manuel, can you tell us something? Did this really happen, and to what extent?
This is an aim, obviously, during the crisis when everything is difficult. The reality, I think, is quite different. I think is not going to happen, at least straight away. We'll see what happened. The government now is every day is weaker and weaker, and I don't know how long it's going to stay in there. So that to tackle now something so big is at the moment, I don't think it's going to happen. At the beginning of this crisis, well, the government said, well, everything is going to be nationalized. Private hospitals are going to be taken and run by the National Health Service. This never happened. And what we have in Catalonia is dreadful. And we have a law, a decree, a few weeks ago, already paying an enormous amount of money for every person that was in ITU in private hospitals, 43,000 euros per patient, which is outrageous. Well, I think this is difficult, and I think all these hospitals, all these consortiums, and are putting a lot of pressure on the government, and I don't think it's going to happen. We need to fight our way if we want any change. I think what we need to do is, there's a lack of vision of politicians, certainly, as Luca was already saying. Why we took such a long time to take action. I think part of it was because the politicians lacked that vision. But certainly to improve the system, we need to change the fiscal system. I think we need to make sure that those companies that are paying very little be more involved in the paying more, whatever they have to.
Thank you, Manuel. Sorry,
I finished. Yeah. I think that all the expenditure in the health service shouldn't be taken as expenditure. I think it should be taken as an investment.
Thank you. That's very relevant. So in Spain, as we've seen in other countries, despite the claims, actually the public system has ended up buying for a very high price services from the private sector, not being able to actually make use of it as a public facility. I now have a question for Veronique about, I want to read it so I don't make it, how did privatization in Belgium affect the COVID response? It sounds like there was a strong response in the hospitals guided by the government, despite big financial losses. So do you see any link between privatization and the response that happened?
Okay. For the moment, I cannot see it in the hospitals. I can see it in the nursing homes, the retirement homes, because they were hit really strongly. More of half of the deaths in Belgium occurred in the nursing homes. I do not have the numbers to tell you if it was in more private homes or public or non-profit, because these are numbers you cannot find actually. But it will, I am afraid that there will be a financial fiasco for the hospitals that have been investing as private or public hospitals in all this transformation and paying the people, sometimes people who were sent homes because they didn't have work for them. But already now they can see, like last year, like a third of the hospitals in Belgium were losing money. Since years and years, they have been telling to the politicians that they have to raise the money they give to the hospitals if they want them to continue as before. And there is a strong call now from the doctors, but also from the nurses. The nurses have been asking for years and years to raise their numbers. We are not enough in the wards to make a work of quality. And since 2 weeks now, the government is hearing us, just hearing us. We don't know if this will get results, but they are hearing us, and we hope that this will bring some effects in the months that will come. Do you have more? Do you want me to elaborate more?
Thank you. No, that's great, Veronique. Thank you very much. There's another question that's been posed to all panelists, but I would like to put to Vittorio, which is basically summarized like this. Do you think the private sector in health should be sort of removed completely, or do you think it should and could be regulated?
I think that the private sector has a completely different aim for the public sector about health system. Private and public have a different mission, because for the private is very important. Private health industry is like every other industry. Their aim is to have a profit, a big profit. For the private sector, it's very important to have a lot of illness. So it's clear. And they are not interested on prevention. They are not interested to avoid illness, because if you are able to avoid a lot of listen, they lose a lot of money. So it's completely different way. My opinion is that it's necessary a public health universal system, completely gratis. You must not pay. Every citizen must pay at the beginning with taxes in a relationship with his profit, his personal profit. But after, nobody must pay. And I think that the essential level of assistance, that in Italy, this means that cure that every people must have, must be given by public sector. Private sector can exist outside completely the health system for the people who want to pay to have a better assistance, or they want to avoid the queue and to have the visit the day after and so on. But I think it should be outside. And another suggestion is that I believe that it is time to have only one health system in a European Union. And I think we need to fight, because the health must be inside the structure of European Union. Instead, until now, the matter of health is completely outside. We can discuss only sometime in European Parliament about pharma, but without take any important decision. I believe we need a European health system, a public European health system. And the last one thing is that after this tragedy, because in Lombardy is really a tragedy of COVID, Medicina Democratica with a lot of other association is organizing a national coordinator to have a national platform to ask to change completely the organization of our health system. And for the end of June, we are organizing the first demonstration, square demonstration outside, not web demonstration, in Milan in front of the regional office. And I think that it will be possible to link together people and the health workers, because also health workers suffered a lot of about this situation.
Thank you very much, Vittorio, also for raising again the issue of the European response. I think it's quite a shared position that we want more from Europe in terms of healthcare. I would like to ask Luca if he can comment. He pointed out, to some actions that the European Union would have should have taken. There was one specific question saying there was such a delay also between the response in Italy and then in Spain and Belgium. And would a European management of the strategy to address the disease, would it have helped? How do you see it?
Chiara, I make always an example that at the beginning of it was March, we had already a first exchange with the Commission on this and so on. we arrived to a situation where member states, I make always the example, we had Germany for mask, we have Czech Republic for ventilators and so on, were banning exporting of this material because actually there was no at all any procedure to keep alive provision of those sectors. So the question is per se answered. Of course, yes, because we have seen not only that it's not effective, but we have seen also that it's cost life on this. Now, for the future, I think that it was funny because 2 days ago, after years of cost effectiveness, increasing out of pocket money, increasing efficiency and so on, the European Commission started saying, reminded themselves that they have to invest, member states needs to invest in public healthcare, and also in aspects like, for instance, primary care, on workforce and so on. The point now is that there are critical aspects also on the European cooperation. That I make you 2 examples and then I shut up. The first one is the fact that the ECDC, the EMA, and so on today do not represent a clear coordination body of the healthcare systems. And this is a matter of fact. ECDC about all this crisis did not understand anything till the mid of March. And this is a matter of fact. And they are our ECDC. In this way, EMA on the vaccine is completely in the private healthcare, in the private hand. The development of vaccine provisions and so on. We do not have on this any coordination, and you have in revenge Sanofi, which comes a private French enterprise, which comes and say, unless you don't invest in our company, you don't get the vaccine. I think that this is clear that we need an healthcare union, but again, we need to fight in order to have a cooperation which starts, for instance, from coordinating the response, trying to harmonize different models, trying to arrive to, for instance, the issue of the stress test for the healthcare systems, and trying to incorporate this to the coordination that we have. We don't need actually Europe to dictate us to make more privatization than before.
Yeah, thank you, Luca. Very, very clear. So we don't need a European Union intervention if it is not in the interest of the people. So in other words, there's a power balance that we need to address. Otherwise, the institutions that come into place will only, reinforce the preference towards profit and not people. So just we have a very, 2 minutes for a final round, which I would like to be action oriented. So Luca, come back again, please. What can we expect from workers' struggle? Is there anything promising coming from this area of struggle?
I would like to be more precise, but we are actually in discussion. But I think that already from what I'm hearing around, and honestly, being in this phase, trade union is an no, I don't want to use exciting, but I've used moment, because for the first time, actually, you find this element of solidarity in all the systems, actually, which comes after what economists call a symmetric shock. And this is, of course, creating also a link of solidarity, mutually reinforcing. I think that number 1 priority is that applauses will not be enough. We need actually to have systems, and we want to have salary compensation. I think already Belgium is already self-evident example that applauses will not be enough. We need to fight for salary, because worker needs to be recognized, but we need also to fight to increase safety and health in our hospitals, because this is fundamental. Being a doctor, being a nurse, being a healthcare assistant cannot be a matter of heroes. And what happened this time, for the sake of our generation and the generation that will come doing this job, cannot happen and will never happen again.
Thank you, Luca. Manuel, what are the Maria Blancas? Are they reacting? Is there a rising again in health movements in Spain? What can we expect for the future?
Well, I already exposed that in my previous presentations. I think that the COVID pandemic has exposed our deficiencies in the welfare state, and now it's necessary to undertake a reconstruction to get out of this crisis. But not only for this reason, I think we must, as other colleagues have pointed out, public services need to be protected, strengthened and developed, and reversing the cuts in health, social services and pensions, and that we have seen already going down during the last decades. Services are the true pillars of the majority living conditions. So I think that to be successful in this endeavor, we need to join forces at the European level and defend the citizens' rights together. Alone, I don't think we are going to be able to. And to have this division between countries, already looking for their economy without missing the big picture of what Europe represents and the well-being of all Europeans, I think we are missing a good occasion to build out a common future and to have a nice structures for the whole society.
Thank you, Manuel. Veronique, is the European network, are they preparing any mobilization? What's under discussion in terms of a voice in Europe?
Okay, for the moment, so on the European network, we were doing this action always in April. We're going to discuss in the future how we can continue on these actions. Okay, but I don't have anything concrete to tell you for the moment. I can tell you that in Belgium, there will be a big manifestation we want to organize, not with the European Youth Movement, but with healthcare workers into what we call Santé en lutte. So we are working on it to get as much as possible as organization, as trade unions, but also professionals of the hospitals and first line to get to this manifestation and to show to the politicians that we won't forget. It's not because there will be summer now that we will forget, and they have to work on refinancing and structuring in another way the healthcare in Belgium. And also that the healthcare in Belgium is centered on the hospitals and not enough on the first line. And this is also something we have to address on our Belgium level, is to develop better the first line.
Thank
so
you,
expect on the 13th September a big manifestation in Brussels.
That's great. Okay, thank you, Veronique. Vittorio, you already shared something about what's going on in Italy. How do you see it? I mean, is it a promising time for a revival of health movements, or what can we expect?
It's difficult to say, because now there is a lot of sufferance in Italy, and a lot of people is crying is dead. But I think that it will be possible to organize a strong movement. For example, the government had to give in the last week a lot of money, not only for hospital, but for medical laboratory and ambulatory on the territory. in the different city and village. And the government has a discussion inside the public and private system. You must think that until 4 months ago, everybody, every media in Italy spoke about the example of the health system in Lombardy. The health system in Lombardy was like an excellent. If you need a trial, if you need a cure and so on, you must go to the Lombardy. So now there is a shock. How was it possible in the richest region in Italy, in the region, in more European region in Italy, this dramatic situation? So I believe that a lot of people is thinking that is necessary completely to change the organize on the health system. I am not sure that we will arrive in a referendum to change the law and to put outside the private system. I am not sure that we will have the strong to arrive to referendum, but probably we will be able to have a million of signatures in favor of to change this dramatic situation.
Thank you very much, Vittorio, and thank you, everybody. As we come to a closure, I really want to thank all the people who intervened. And before I will give the word to Oriol for the final remarks and also way forward, I just want to say the key messages that I think I captured from this webinar. So we want definitely more public. We want a public healthcare system, and we want a public that is in our control, in public control. We don't want a public that with our money subsidizes or finances the private system and the private profit. We want more primary healthcare. We want reorganized and strengthened territorial system, community-based assistance. We need investment in that. We need training in that direction. We want more staff and better working conditions, and the two are related, because when you're alone, or you're not enough, you don't work well, and also because people need to be safe when they do their care work, also because they become a danger for others. We need to rethink our fiscal system in order to finance all this. We need to tax who needs to be taxed, who makes the profit, in order to subsidize our public system. And we want a role for the EU, but it is critical. It is attention. It depends on whether we have the strength to make our voice heard and to influence EU's decision in the favor of people's health and not of few people's profits. I think we have clear directions also for organizing our struggle. It seems like things in countries are happening. Things in Europe have been happening, and we need to continue even stronger in that direction. And I think many of us will keep on seeing each other in the activist spaces in order to organize our struggle. So thanks, everybody, particularly to the speakers. Thanks for the participants. Sorry if not all the questions were answered, but again, we can continue the debate through all the other platforms that we animate on a daily basis. Oriol, now to you for the closure. Thanks. Oh, thanks a lot to the visual facilitation was awesome.
Yes. Thank you, Chiara. And yeah, just as you said, thank you for your wonderful facilitation also. It's been very interesting also, like that, the way you were able to grab all the conclusions. And just to mention that thank you, Vittorio, thank you, Luca, thank you, Veronique, and thank you, Manuel also, not only for your very valuable interventions, but also for your activism and your commitment. And thank you, everyone who was present during this webinar. And for your participation in the chats. I think that all the interventions were very, very interesting. And as you know, as we said before, in a couple of days or 3 days, in some days anyway, we will be sending you a link for the video that was recorded of this webinar, which has been also live on YouTube. But also we will be sending you the 2 versions in English and in Spanish of the fantastic work that Martin Toñola has been doing live. So thank you also, Martin, for doing this. You will be receiving that at home. And well, at home in your email, but that's more or less the same. And also, of course, thank you for the wonderful translation and the big effort from Laia and David from Koinos Cooperative. So that's it from our side. Thank you for being present. Just to remind that in the health rights action process, we will keep organizing spaces for social movements and international networks to meet, like this one. Because our goal is to strengthen the capacities for organized civil societies to defend and implement the right to health for all. So in the next months, we will be organizing more webinars, communication campaigns, training opportunities like an international public health university where activists from all over the world can participate. So we hope that during this time we will be able to strengthen links and cooperation between all of us who were here. So thank you very much, and we can leave it here.
Bye-bye.
Thank you. Goodbye.
Bye-bye, everybody. Thank you.
Bye-bye. Bye-bye.
Bye-bye.